Hello, everybody. Welcome back to Safest Family on the Block. I am your host, Jason, and joining us today is none other than our very first guest, Mr. Justin Schorr.
Hi, everybody.
Greetings, sir. Welcome back to the show.
Thank you for having me. It's great to be back.
Yeah, it's so cool that you came. Now, for folks who didn't see the first episode, and you should all go see the first episode, why do people care who you are and what you have to say?
Well, I'm a almost now 30-year veteran of the fire service. The last 20 years have been with the San Francisco Fire Department, now as a paramedic supervisor. If you can imagine an emergency situation where lives are hanging in the balance, chances are I did that in the last 24 hours.
Especially as we were talking before the show, that particular 24 hours, national holidays, the stoner set.
Yes, 420. Happy 421, everybody, which is the National Day of Surprise Drug Tests.
I'd never thought of that, but I'll bet you it's true. And so Justin volunteered to come on to do one of our loadout episodes where we talk about the kind of equipment families should have to make us safe. Now, we earlier did an episode with set medic Steve Mullins about a home first aid kit. And so Justin was going to talk to us about the first aid kit for your car. And to start, what are the big differences between what you want in your home first aid kit and what you want in a car first aid kit?
Well, I'm going to sound a lot like those guys on late night TV. It can go in your car or your RV or your boat. What we're going to talk about today is pretty much a small go bag of sorts that will get you at least squared away on a hike, a short trip, something that can get you either to your home first aid kit or to an urgent care or hopefully not an emergency room or until the paramedics arrive. So that's what we're going to cover today. Just some of the stuff you should have on hand in case, life happens while you're out and about.
So we're looking for things like kid cuts themselves in some unknowable way the kids sometimes do, to managing a blister if you're hiking, to if you happen to be in a car wreck and something that shouldn't be inside of somebody's torso is now inside of their torso.
Exactly. We'll talk about the basics from my tummy hurts all the way up to my tummy is on the outside.
All right. Excellent. And you brought with you your first aid kit, the one that you use to keep your family safe?
Yes, this is the kit that I use when we go camping and when we're out and about. This is in one of these fireman-specific bags, but it doesn't have to be one. I have teenage daughters, so we have a multitude is kind of an understatement of these makeup bags and little zippered pouches that they get with gifts and whatnot. Anything that can keep things from getting dirty, messy, oily, and something you can find quickly if you need it is really what you're going for. The reason I chose this one is because it specifically got 2 compartments on it, and you'll see I don't know if your video is backwards or not, but your folks might be able to read. I've got it marked.
Okay.
Because we firemen like everything shapes and colors. So if I send one of the kids or the wife to get something, they know which compartment we're going to be opening up.
Okay, nice. Okay. And then how much does that run? I imagine I could find something like that on Amazon.
You could definitely find something like this on Amazon. I would imagine this particular one probably goes for about $30. I got it at a conference for free. So that's my favorite price for things.
Okay.
But like I said, you're going to have a lot of little zippered pouches around the house or something. An old lunchbox that you're getting ready to throw out that can zipper up is going to be the perfect thing to keep some of these supplies in. You just want to keep it clean and all in one place.
A couple of the bells and whistles I'm noticing on that are the big, robust zippers, so you're not fiddling with it when your fine motor skills are compromised because of the adrenaline. The reflective patch around there, both for having on you if you're treating something at night and also to make it easier to find.
And then it's also got the belt strap, which is just a handhold. I've got it wrapped around and folded just so to stay more compact. This isn't something, this is originally designed for rapid triage in the emergency setting. So this is designed to be worn as a front pack and used that way. But we just use it as a very easy to carry handle.
Okay, excellent. And I noticed you labeled your 2 compartments medicine and bandages.
Yeah. So those are the 2 main things we're going to be looking at. If you have a headache, you don't want to be digging through all the adhesive bandages and the triangle bandage and all the other stuff we're going to be looking at just to find the ibuprofen. you want to have those things separated. It also makes it a lot easier to go through every couple months and make sure nothing's expired on the medication side, and you don't have to dig through all the bandages to find it. Because as you'll see, this isn't where I just went to the store and bought 30 of everything. There's specific doses of everything that we carry with us, because this is, again, designed just to get us to a safe place. This isn't designed to keep us safe at home for the big earthquake or anything like that. We have other supplies in the house for that.
Okay, excellent. Now, I've seen other divisions in kits where it's rather than medicine versus bandages, boo-boos versus trauma. And I don't know if one is better than the other, or what's important is you pick one and stick with it.
Pretty much, yeah. You always want to start low and aim high is always the mantra I go with. But I'll talk about some of the specific things that I carry as a paramedic. You might say, why don't you have this and why don't you have that? Because I carry the kind of equipment that can multitask and do a number of different services for me based on what I need. And one of them is an old tried and true Boy Scout go-to that I think will make you smile. So
let's start there.
All right. So we'll start on the bandages side. And what I'm going to do is just pull out everything we've got on the bandages side, and I'll describe why we've got it.
Sounds good.
I mentioned there's lots of these little zippered pouches floating around your house. Here's a very brightly colored one you may like. This is where we keep a variety of different sizes of adhesive bandages. You may know these by the brand name Band-Aid. You can pick them up at the store. We've also got some small alcohol wipes. My daughter's diabetic, so our house is floating with these. And then every now and then you stop by a restaurant and they've got the wet wipes for the ribs. Grab you a couple of those, put them in there. This is just for basic. I've got a cut on my finger. We're going to clean it and put an adhesive bandage on it. And it's a little bit bigger than my wallet. So
okay,
that's perfect for that.
So that's a classic boo-boo kit.
Classic boo-boo kit. And then moving up from that, we also have, you can buy these tiny little containers. And we've got, we just put some hydrogen peroxide in there and we labeled it. This is for a little bit bigger, the boo-boos, the road rash, something that we need to really clean up. For example, falling off your bike at the campsite, now you've got gravel in your knee. This is going to come in handy to help get that out. Also to help get that out is going to be your pocket grooming kit that you're going to find pretty much at the checkout aisle of every store you've ever been to. You can pick these up for about $1. You've got basic scissors, nail file, nail clipper, and tweezers. Those tweezers are going to be some of the best tools that will be in your personal first aid kit, especially if you have kids. If you're going camping, ticks are around. Be able to pull those out, splinters, you name it. I had a nasty splinter the other day, and wouldn't you know it, this came in handy.
Hey, quick question, backing up to the hydrogen peroxide. For the last 10 years or so, I occasionally bump into some blog post or video about how somebody proved that hydrogen peroxide doesn't clean wounds, and you are the person who would know whether or not that's nonsense or whether or not that's true.
Yes, it does.
Excellent.
Yeah, that's why they use the iodine and the hydrogen peroxide in the operating theater. Now is this the all too this is going to solve everything? No. This is to clean out any biological that's in the open wound, and this is for your shallow wounds, your raspberries at the softball game, like I said, road rash from falling off the bike. This is just to clean it out and get it clean so we can put a bandage on it. This is not, okay, you're good to go, see ya. But this is also, hey, we need to get you back to the campsite. We need to do some more stuff once we get there. In addition to that, we also carry some antibiotic ointment to put under that adhesive bandage. This is going to be most important for a lot of those cuts and scrapes that the kiddos get. Of course, you put direct pressure on it right away to get the bleeding to slow down and stop. As soon as it does, we want to clean it out a little bit, make sure it's clean, then an adhesive bandage. But before that, the antibiotic ointment, we'll throw that on there. It always feels so funny. Not quite liquid, not quite solid. Also, we've got just a quick pack of moist wipes. Again, not only are we cleaning a wound, but we want to make sure the hands that are treating the wound are clean. Last thing you want to do is show up to a child's injury with nasty hands and actually introduce some sort of bacteria or virus into the wound. So make sure you wash your hand. It doesn't need to be, ready for the operating theater and wash me in, Dr. Jones. But definitely get yourself cleaned up and go in that direction. Eyeglass repair kit. Super handy. So we carry this not only to fix our eyeglasses, which a lot of the family wears, but you'll see in there that it's also got small screwdrivers. These are good for prying and removing foreign objects. It's also got a small magnifying glass, which is perfect for doing that. And it's a nice hard-sided kit that'll let you really focus in on what's going on. You can pick these up at your local dollar store or grocery store. And that's always good to have with you. And, little tools. I've actually used this more for changing batteries on our little walkie-talkie radios than anything else. But that's where we keep that. So we also have that. We're still in the bandages compartment, remember?
Quick question about that. And with the understanding that this podcast is for advice and entertainment, and Justin is not giving us medical advice. Listen up again, lawyers. Justin is not giving us medical advice, but you mentioned removing foreign objects. There's a point at which you emphatically do not want to remove the foreign object, but rather stabilize it and let that removal happen in a trauma center. Is there a rule of thumb about when you leave it in and when you take it out?
Yes and no. That's probably a good 3-hour lecture on diameter of the item, depth of penetration, body location. Pretty much what you want to go with is if you feel nervous pulling it out, don't pull it out. What I'm looking at is, the example I keep giving is you fall off the bike and skin your knee and there's some big gravel the tweezers aren't getting. You can use the screwdriver to get in there and kind of get it out. Just another tool that you can, pour the hydrogen peroxide and a little alcohol on and try to get that splinter out. But when you accidentally shoot your buddy with the bow and arrow through the arm, that's not something that a tiny little eyeglass screwdriver is going to help you get out. Anything that's in a moving joint that's prohibiting the movement, you want to try to splint that in place and call for help and stay where you are. This is mainly for this doesn't seem so bad. That's what this kit is all about. Mainly. We're getting into the good stuff. All right, so I carry a small 2-inch cling wrap. You can get these in most first aid kits or at most of the grocery stores. And pretty much what this is just to wrap an injury. Say I've got something that's a little too big for the adhesive bandages. I can cut off a section of this, place it on the wound, and then wrap this on it to keep some constant pressure on it. If I've got an oozing wound, an abrasion, something like that we just need to really keep clean until we get somewhere where it can be properly taken care of.
Okay. And does that stick to itself, or does that need some tape?
No, this will use tape, or you can always just tie a knot and tuck it under itself. Use some friction. And the thing I always do when I'm working is let's say my right arm is hurt and you wrap my right arm. Well, look, I have a left hand. I can hold it myself. Okay. Put me to work. Put your patient to work. That's what we love to do. All right, and now the final item in the bandaging side. Now, keep in mind, this is the final item. What haven't you seen? You haven't seen any big trauma dressings, right? You haven't seen any big bandages for that situation that I mentioned where your insides are on your outsides. And that's where the most versatile piece of kit since Napoleon's army wandered the earth, the triangular bandage. This is the best and most versatile piece of kit you can carry. If you carry nothing else, if everything else you saw in this kit is, I don't want to do it, I've only got room for one thing, the triangular bandage is what you're going to carry. Not only because you can splint an arm with it, it works as a wrap bandage, it works as a compression bandage. We can use it to stuff a bullet wound if we need to. We can use it to stop bleeding. We can also use it to fold and cover something that came out from the inside to try to keep it clean. This is, you can even turn this into a windlass tourniquet using a stick or a pen. YouTube is your friend to find videos on how to do that and when to apply it. But this one little tiny 3-inch by 3-inch by half-inch piece of equipment is the most versatile piece of first aid equipment on the planet. Fight me.
All right. Nice.
Yeah. Napoleon's army used to be required to carry these on their person, and they wore them as cravats around their necks, and they were triangular in shape. And yeah, anywhere I go on the ambulance, and it's 2022, I have multiple of these because they are so
Okay.
perfect.
Okay. So if that's the end of the Band-Aid box, I do have one question. I'm sure you have an answer. Is what I notice isn't in there is any kind of trauma pad. Big pieces of cloth to put on the wound and applied direct
Correct. And
pressure.
so there's two reasons that I don't carry those in here. Number one, that bandage alone would be bigger than the entire kit, folded up. And number two, I notice you're wearing one right now, as am I.
All right.
Yeah. So we're gonna use equipment that we already have on our person. If that triangular bandage isn't big enough, then I'm going to remove my shirt, fold it up. If I can't find anything to make a windlass tourniquet, I'm going to use a wide leather belt or a gentleman's necktie. I'm going to get creative with the things around me. Now, that with my experience, that's something I'm going to be able to do very quickly. But again, we're looking at the kind of injuries that are most common that I come across, that I've been working, that people say, well, if I had only had blank, we wouldn't need you. And that's kind of what we're looking at. So that triangular bandage and the shirt you're wearing is going to be far more beneficial than a giant trauma pad that you may or may not ever use.
Makes sense. So you use a term windlass tourniquet. Could you define that for us?
Yeah. So what it means is that it's got a friction element that involves a spinning pen here. You'll see this felt tip pen. What you're going to do is wrap the triangular bandage above the wound on a non-articulating joint. And again, this is just basics on how to apply it. If you want to learn really how to apply a tourniquet effectively, go find a Boy Scout manual, talk to a doctor friend. But what you're going to do is tie it once, put the pen in, tie it again, and then start twisting the pen. And as you do, that's going to constrict that triangular bandage around the body part. It's going to be the upper arm or the upper leg, and that's going to pretty much just cut off the flow of blood past that point so that the wound stops bleeding. And as soon as it stops bleeding, then you tie it again, and that stays there. And you never remove it. You only let the doctors with the bright lights and cold steel remove it. And that's even true for me.
Okay. Excellent. And those Israeli bandages are basically that with they're basically just that, only a little tacticaled up.
Yeah, so there's a number of generations of combat application tourniquets, CAT tourniquets that you'll see. These are what police officers carry. This is what we carry on the ambulance and on my vehicle as the supervisor. These are very rapidly deployed, applied, and the windlass is built in. You don't have to find something to use it. They're kept compact. They're great pieces of kit if you are going to encounter one of those wounds often, as we do. I don't carry one because, again, I'm asking some of my equipment to do double, triple, quadruple duty while in there. If you have access to a Cat 5 tourniquet and you're going to carry it, make sure you understand how to use it. A misapplied tourniquet is worse than no tourniquet at all.
Excellent. All right, and one more question about tourniquets. I know in my lifetime, the medical advice has gone from use a tourniquet to don't use tourniquets, and now we've kind of, in the last 5 or 6 years, started looking back and being friendly to tourniquets again.
Yeah, and unfortunately, the one benefit you get from war is that we're figuring out how better to keep soldiers alive far away from the operating theater. And what we've learned is that tourniquets and intraosseous administration of IV fluid, something that I don't carry in my kit, by the way, is something that's going to keep people alive for a long time until they can get to an operating theater and actually have the surgeons work on them. What we learned from the Cat 5 tourniquets is these soldiers would get there, apply it quickly, the bleeding would stop, and then when they get to the hospital, they can slow down, figure out a plan to save the limb, and move forward from there, and they're having fantastic success. So if you do have bleeding that you cannot control with direct pressure, go straight to tourniquet.
Excellent. And again, if we don't have anything fancy, we're going to have that triangle bandage, a belt, a necktie, even this sleeve probably in a pinch, tear it off. Okay.
Yeah, or just, ask somebody wearing a short sleeve shirt because, of course, or a long sleeve shirt because your short sleeve shirt is holding direct pressure. And you never know when you bump into somebody else in the wild that's got another first aid kit with them, and you can kind of pick and choose from both of your kits and see what works.
Makes sense.
Mhm.
And so that's the entirety of the bandage box.
Yep, that's it.
And then we have a medication box.
And then we have a medication box. Let's dig into it. So we don't carry, I mentioned one of my daughters is a type 1 diabetic. We don't carry any of her diabetic supplies in the first aid kit. Those are carried separately, specific to her, because they need to stay with her, not with the family. So if she peels off and goes in one direction, she's taking her pump, her insulin, her back, all that other stuff. So if you have a child with a specific medical need, those things need to be carried either by the parent or by the child if they're old enough to manage it themselves. It shouldn't be in your first aid kit. All right, so cough drops. These are huge when you're out on the road. Somebody gets a little sniffle, a little cough, pop cough drop. You're probably going to feel better in a little bit. If that turns into something more intense, we just carry a couple doses of adult severe decongestant, cough, cold, flu medications. If you're out and about, you're driving to grandma's house, you're staying at the hotel for a night, this will get you up and over the hill until you can hit the CVS in the morning and get something more specific. Again, you're out camping, they're at a sleepover, whatever it is, we've got some of that. So cough drops, we've got that medicine. We carry a anti-nausea medication that's commonly given on the ambulance. Ask the doc for a couple of these. These are just little fizzies that go under your tongue when you're nauseous, and that'll slow down any nausea that you have. Can be.
Does that have a brand name or generic name that we should ask for it by?
Ondansetron.
Ondansetron?
Zofran is the trade name. Yeah, you can ask for that. This one always cracks everybody up, but in the medication, sometimes if dad's having a bad trip, the bottle opener. A very important medication. We carry itchy eye relief. Sometimes you're out, the hay fever gets to you, there's a lot of stuff blowing around, you've got something in your eye that you need to rinse out. We can do that with the eye drops. Haven't had to use them yet, but that's kind of why they're here. And this is a big one for our family, fresh ibuprofen. This is very good. If ibuprofen doesn't work for you and Tylenol is more your speed, that's what you need to be carrying. And then also another note just on if somebody's got indigestion for the week, whatever it is, you can add specific over-the-counter medications or treatments, whatever it is, home remedies. You can add those to your kit for a short time. But I would prefer that you just have those on you for the short time. This kit is really just for it's always in there or grab and go. If you're having specific symptoms for a little while, you don't want to really dedicate that to your first aid kit necessarily, excuse me. You just want to have the stuff that kind of in a pinch, we forgot it, or, oh no, I don't feel as good as I thought I would feel. And that's really what we carry with us.
All right. And so if you got a family with a lot of hay fever and stuff, I'm imagining like some kind of what's this stuff? I'm completely blanking on the name of the thing I take every day in the spring. Claritin.
Yeah, you can have some Claritin, some diphenhydramine, Benadryl is a trade name for that. Like I said, specific to your family, you're going to be adding those things in or keeping them with you as you travel. Like I said, this is just kind of a kind of bag, not a let's go bag.
Okay. Yeah, just get from point A to point B, stabilize people in place, and keeping it portable and small so you can carry it with you hiking so it doesn't take up too much space in the glove box.
Yeah, and that's the big trick is the bigger the kit gets, the more you're going to want to take it out of the car. When you go to the car wash and then you forget you took it out and now it's in the garage and it gets kicked under a shelf and now you need it and you can't remember where it is. So the more specific you make the equipment, the more dedicated to one purpose the equipment is, the larger it's going to be, the less you're going to use it, and the more you're going to think, I'm going to take this out without replacing it with something that can be beneficial. And that's the key. That's one of the reasons that they found out that the tourniquets are working better, they are worse when they're applied wrong because people put it on wrong and then stand back and say, yay, we did it. We don't have to do anything else. And they're not noticing that person is bleeding out right in front of them. So having the things with you to be able to just get over that hump of, oh dear God, what do we do next? That's
Yeah.
what my family's got. We've got a little bit more equipment in another bag in our camping trailer that we have with us, and that's just splint, some more Acrylics wrap, and a chemical ice pack. And those are just in the trailer because we have more room. That's not something that we move around with us from place to place.
Makes sense. Also seems like for a camping trip, some of those things that if you spray your ankle and you need a cold pack, you're not gonna, and you don't want to go back into town for it. Just a couple of things that would mean that you don't have to scrap the whole trip for something that's a little more than a boo-boo.
Correct, and there's a good chance that you've got ice in a cooler and a
Yeah.
towel or a rag. You can get your triangular bandage out and fill it with ice and put it on the ankle again and wrap it on and tie it there. There's literally nothing that triangular bandage can't do. But just having those little extra pieces that you want to add in, just based on your family's experience. If you're out motorbiking a lot, you're probably going to need more cleaning equipment because you're out there cleaning the bikes and your hands are going to be nasty when you're trying to fix something. And the one other thing that was in the bandages side that I didn't get out that I just realized is I carry a small tube of super glue.
Oh, yeah.
So if we do have a laceration that I'm able to get the bleeding controlled, but I can't really close it up and keep it safe, I will go to the extreme based on how I feel as a layperson. And if necessary, super glue the skin together and get them someplace where the doctors can numb it and cut it back open and clean it, because that's going to hurt.
I had that situation. This was years ago, 15, 16 years ago now. I was home alone and put my hand in my pocket, not knowing that my folding knife had opened in my pocket.
Ooh.
And it was right there on the right index finger. And after 4 or 5 iterations of holding direct pressure and then trying to get the bandage on, and it was bleeding too much to get a Band-Aid to stick, I finally grabbed some super glue and did the trick.
Anyone that's ever used super glue knows that it gets on skin and it doesn't let go. So there are times where you just let it.
Yeah.
Yep.
Excellent. So one other question about that. So we've talked about the stuff that goes into a car first aid kit, and that's useless without the knowledge. And you come with decades of specialized training and tens of thousands of iterations of practical experience. For just a layman parent, what kind of classes or skills would you recommend we go ahead and get in us so that we can use that kit most effectively?
Most importantly is going to be the stuff that you can't fit in a kit, and that's going to be the knowledge of how to use the Heimlich maneuver and remove a foreign object out of an airway. If your child is smaller, that's going to be back blows and chest thrusts. You can learn these through videos. You can ask a responder friend in your local area, or you can reach out to any of a number of community organizations that teach this officially. You'll go in a classroom, you'll practice on a mannequin, you'll show proficiency, you'll take a written test. They'll give you a little piece of paper that says you learned it. But if you're not comfortable doing it, what's the point of learning it? So if you're not comfortable with how to remove something from a choking child, that's something you definitely need to learn, and also from an adult. And then also recognizing someone who may have a serious head injury. Kids fall down all the time. I always tell parents they're made of rubber and you don't get to panic until I panic, which of course on the inside, I'm going down the path of worst case scenario and having to deal with that. But as a parent, I do have that secret of being able to tell whether or not my child is likely to be severely injured from a head injury. But just looking for lethargy, does the child appear sleepier than usual? Is their gaze wandering? Do they look at you and then just kind of look past you and to the side? These are all things that could be a sign of a more serious head injury, even just a bump on the head, depending on where they hit it and what their condition was when it happened. A lot of kids wearing helmets out on bikes. That's excellent. They still fall. They still hit their head. You still need to keep an eye on them for a little while.
Okay. Excellent. And what's the smart question I should ask you about this that I haven't?
Oh, that's a great question. I would have to say, what was that orange stuff on the outside of the bag?
Do you mean the coating or do you mean the scissors?
The scissors. There you go. That's one other thing I didn't show you is I do carry some of these penny cutting scissors that you see on the late night TV shows. These are excellent for cutting clothing off to assess a wound. And then I also carry a Sharpie pen and a ink pen. And the ink pen is mainly so I can write my notes. If I'm taking care of someone else, I will write what I'm doing on them. And then the permanent marker is anytime you apply a tourniquet, as you'll learn when you go off and get that skill for yourself, you're going to write down who put it on and what time you put it on, so that once they do get to the surgeon knows exactly what they're dealing with. Also, you'll never believe how many times you're out and about and you need a pen, and the only pen in your car is the one in the first aid kit.
And on that topic, my brother, this was years ago when their oldest was only 2 years old, 1.5, something like that. There was a multi-car pileup, and they wanted their child to go. They needed to go to the hospital for checkup, but there wasn't, for some reason, they weren't able to transport the parents at the same time. Mm-hmm. And so the mom just literally wrote name, address, phone number on the kid's chest in the Sharpie they kept in the car.
Yeah,
so it's a good way to communicate whatever you need to off-site medical.
Yeah, and you're never going to know when you're not able to tell them the same thing. We had some friends of ours lost their house in the river fire last August. And as they were evacuating, they were worried, what happens if our car gets overtaken by flame? How are they going to know who we are? And I told her, you should have just written your name on your arm, and then they'd know. And the color just drained out of their face. And I was like, I'm sorry, I was still in paramedic mode. Friend mode, I don't know. What could you have done? But yeah, that's not uncommon to do that. You can also write notes, quick write something down. You're evacuating. You're taking our dog. Here's our contact info. Thank you. Let us know when you reach safety. Anything like that.
Yeah. Excellent.
Yep. Useful. But yeah, like I said, the biggest thing is don't let your kit get too big. Keep it simple. Keep it family specific. When you do get to that bus accident where there's 50 people lying in the road, your personal first aid kit is going to do very little for those people. Know where you are at all times. Kind of quiz yourself when you're on a long drive. Where am I? If my car broke down or there was an accident in front of me, do I know where I am? Even though the dispatchers can get your cell phone info, they triangulate. Sometimes the signals aren't that great, and it gives us somewhere within 1.5 miles of this location. Well, that's a big radius to be able to search. Yeah. So know what exits you're between, near, what road, what highway you're on, which direction you're going. So if that pileup happens, the best thing you can do is relay good quality, up-to-date information to rescuers.
And that just ties right into situational awareness, which is a whole other important safety skill.
Yeah, and that really ties in with everything, but you can't exhaust yourself. Don't.
Yeah.
If you're on a 7-hour drive, don't every 5 minutes try to quiz yourself on where you are. It's just one of those things that when you're bored, hey, where am I? If I needed help, would I be able to get someone to us? It happened to us. Our van broke down when we were driving on a 7-hour trip, and I had the kids and the dog, and we were going on a week-long cruise. So we had all the stuff in it, and we pulled over.
Oh, no.
Yeah, and the van was had sprung an oil leak, and we were burning oil underneath the van, and it was just a quick, where are we? Just, okay. Started looking at rental cars. Eventually, we're all crammed in a smaller car than we had before, and we made it, and it's a hilarious story now. But you meet interesting people in interesting towns you never knew existed when you have to get towed off the 5 freeway in the middle of nowhere, California.
Excellent. Well, Justin, I know that you're very kindly doing this at the end of a 24-hour shift, so I'll bid you adieu this time around. Folks, thank you for watching, and thank you for coming on, sir.
Yeah, thank you. And one other thing I'll add, just as a family with pets, my dog is down at my feet right now, wondering when I'm going to be done. A lot of this kit can also be used on your pets. So keep that in mind. And if you are going to do that, make sure you are comfortable doing it. Again, the internet is your friend. Talk to your vet. Hey, these are the things that I carry. Should I be carrying anything else when we go on trips with the pets? So thank you very much. And I hope to talk to you soon, old friend.
Yeah. Thanks, Justin. Thank you, everybody, for watching. We'll see you all next time.
Be safe.